Hello guys, Dr. Dean here. Today we are going to talk about one of the most common neurological condition, and that is headache. You will not find anybody who has not experienced this in their lifetime. And there are more than 200 different types of headaches. We as a neurologist divide headaches into two main categories: primary headaches and secondary headaches. This division helps us to make a correct diagnosis. I personally believe the most important step in the management of any headache is the correct diagnosis. In our daily routine, we do see all different types of headaches, but the most common headaches what we see in our clinics are migraines and tension types of headaches. In the next series of lectures, we will talk about different types of migraines, their symptoms, how to diagnose them, and different types of management options like pharmacological therapies, Botox, nerve blocks, sphenopalatine ganglion blocks, different new clinical trials, and new medications. It will help us to understand what the headaches are and what is the management and what we can offer to our patients.